No?
So, welcome to another session on fever questions answered. And I received a few questions on how to handle fever, specifically about some remedies and some uh, repetitions that need to be done. So, I would like to answer those, and this is day 5 of fever questions answered. And hope if you have not gone through the previous few sessions, there were 4 sessions of fevers which I undertook. There were some discussions that I did on when to use sulfur, repetition, potency. Uh, there was question about fever case taking, children's fever case taking. So I answered most of them in the last 4 sessions of the fever question answered Instagram and YouTube live, and this is the 5th session. So today I have received one question which is very unique, and that is when to use nosodes in fever. So it's a very interesting question, and what you see is nosodes are disease products if you study them clearly, and of course we all do. So one of the interesting things about nosodes is that they are disease products. So whenever you have a case which is having a very strong pathology, it can be something that is a bacterial infection, it can be something that is not yielding too soon to any medicines. There can be chances that there are a lot of multiplication of the virus also, or the bacteria, or the pathology is getting accumulated in the organ, and that is why the fever is happening. In those cases you can uh, start thinking about nosode, because your constitutional may or may not be able to act in a proper way, because the disease is going on another plane, and also the pathology is getting you know causing structural damages. Those structural damages may not be recovered soon by your constitutional medicine. If that is the case, when the patient is not improving, then you have to think of nosode. When to use which nosode, this is a very systematic question which I would probably be answering in the fever workshop. So in cases of chest troubles, what nosode you can use? In cases of skin troubles, what nosode you can use? In cases of urinary tract infection causing fevers, which nosode to use? In cases of throat complaints and fever is there, your remedy is not working, which nosode to use? So there are different indications for nosodes, and based upon how and which place the nosode is the acting, and there are predominant symptoms of that sphere of action of that nosode, the nosode will be indicated, and some other parameters which I have kept, which I would be sharing in the fever workshop. So that's it about the last question, that the only question in fact which we had from in the personal message. And if anyone has, the audience who are right now watching on Instagram, we have a few viewers, on YouTube we have a few viewers. If you have any questions related to fevers, which you feel that are worthy of getting an answer, and you are stuck up what to do, how to do. So you can ask me the questions in the comments related to fevers. It can be about medicine, it can be about materia medica, it can be about the potency, it can be about repetition or follow-ups, anything you feel like, and I would probably bring out something from my experience and something that how I have treated such fever cases and answer you. So anyone who wishes to ask, Dr. Manikhan Konkala, Dr. Shreya Tamahanpure, Dr. Ashwin Jain, Nirmal Anwar, Radiant Homeopathy, Dipshika Singh, Rishabh Dandi. I don't know how many of you are online, but if anyone wishes to ask any questions, please feel free to uh, chat in the comment or type in the comment, so I would be in the best position to answer it. And meanwhile, just for the update that the fever workshop begins tomorrow, which is 15th August. Whether you want fear from fevers or freedom from fevers, choice is yours. So you can decide that and register for this workshop. This is going to be a never before experience. No one would probably teach you fevers in this way, in the way which I have formed the ideas based upon my experience of 15 years, and it's going to be a huge truck of knowledge which is coming towards you. It's your choice whether you want to get on the bus, get on the truck, and come to the place where you can confidently handle fevers, or whether you want to skip and then keep on suffering because the patients will will always be taking allopathic medications, will always be going for all the other routes to calm down their fever. They'll go to the specialist directly. Homeopaths need to be confident to get the patients in their clinics by giving results in common complaints: cough, cold, fevers, all the acute and subacute complaints. Otherwise, we all homeopaths rather, are all known to cure lingering and ongoing skin diseases which persist for 10 years, 20 years, joint complaints, gastric acidities, headaches, migraines. We all are treating that which are already existing problems since the last 10 years, 20 years. The patient suffers. But if you want to be in a position to give good confidence to your patients so that they return back to you, they come back to you 1,000 times, and they also keep on referring 1,000 more patients, then you need to be confident about treating fevers. So, and also the subacute and acute complaints, it can be ear, nose, throat, it can be throat complaints, it can be any acute pain in the abdomen, urinary tract infections. All these things need to be mastered to give results in your practice rather than just cure the lingering chronic problems and go nowhere because you have an easy life and laid back attitude. So if anyone, I don't know how many attendees have questions about fevers, or I think everyone is able to cure fevers magically. So they have no questions about fevers, which is very interesting. All homeopaths are so confident. I'm glad. So if there are no requests and no questions about fever, how to handle, let's make a move. And tomorrow onwards the workshop starts, which in which many attendees would be learning about how to handle fevers, how to take a patient's case, how to classify symptoms into rubrics, what they will tell you, and how do you analyze the case, and what proforma, what case taking proforma you need to follow. In chronic case taking we all follow a proforma. It can be location, sensation, modality, concomitant, physical generals, mind symptoms, and whatnot. But in acute cases, are you following a proforma? Are you following a pattern to come to a result where you will be able to give some result to the patient by analyzing it correctly? I don't know how many of you are doing that, but if you all are not doing it, it's high time you should join this workshop. And tomorrow onwards, the workshop begins. But if anyone registers tomorrow, the prices are definitely be increasing, because we have been making announcements since the last 2 months, and it seems only a handful of people, or a certain class of homeopaths are interested. Many reasons are varied for non-interest, but it is an investment to help you understand fevers like never before. So that is what is the message from me. And one more question has come in WhatsApp group which we have, where the person is telling that how to follow up a fever case and when to follow up. First thing that you should do is every 6 hour a follow up should be done, and you should have a parameter of how the patient is improving and what are the indications that show that the patient is improving. If those indications are met, then you can definitely proceed with the same medicine. If not, retake the case after 12 hours at least and prescribe a new medicine or an intercurrent medicine based upon the patient's current symptoms. Or if you feel like it's a deeper state which is coming out in the fevers, prescribe a deeper medicine. It can be a polycrest as well. So in this way you can understand how and when you can repeat or change or follow up a fever case. So that's all from my side. It extended to 13 minutes. I try to keep it within 10 minutes, but that's all about the fever workshop and the fever questions which are burning and very alarming for all homeopaths to understand. So that's all about the session today, and goodbye everyone.